Hi, my name is Kameron Matthews, and I am a proud family physician. I would love to tell my story, so hopefully that I can help you feel encouraged as you consider a career in the health professions. Because I know it's a difficult path for many to even think about how long it could actually take to become a physician, but actually it's well worth the wait. I definitely encourage as many as you as possible to look at medicine as some as an option to really help enrich yourself as well as the patients that you serve. Let me tell you a little bit about myself because I have a very different story. I'm a family doctor. Yes, I am in primary care. I love taking care of all different ages and walks of life. I love taking care of babies and older patients, delivering babies as well. But really early on in my career, I recognized that I wanted to do more than just take care of one patient at a time. That seeing patients in the exam room was not entirely making the impact that I wanted to make. So I made a decision. It wasn't necessarily the cheapest one, but I made a decision after talking with some mentors to take a different path and to become more of an advocate and go to law school. After my third year of medical school at Johns Hopkins in Baltimore, I decided to take really the opportunity to learn more about how to not just advocate for one patient at a time, but for communities of patients, and to really be able to make a difference to me in the same sense that primary care does, which is through prevention, which is through setting up a healthcare system that I can help patients perhaps find their own cure for disease or even prevent disease in the first place. So honestly, law school wasn't that really big of a stretch. I ended up being a non-science major in undergrad. So yes, for all of you students and out there who just really can't take that much science, neither could I. I was good at it, but that doesn't mean that I necessarily loved every bit of it. I saw, again, a different perspective of how we could actually address healthcare, and that was through my major of public policy, where we were looking at ethics and political science and leadership. And for me, that was a very important set of skills that I needed in order to become a leader in healthcare. That was one thing I knew very early on. I wanted to be a leader. And so public policy and then law school really have helped me get there. So currently living in Washington, D.C., I am what I would consider to be a physician executive. I work for the federal government, and I help run a very large program for a federal agency where we are responsible for providing improved access to care for millions of patients. And I'm excited about that. And as a clinician, it is so important that I am involved with these decisions, that I am helping create this program and improve this program so that really, as an advocate for my patients, we're making the best decisions that we possibly can. I think that's one of the difficulties within healthcare, that a lot of the leadership roles, including the CEO of a hospital, the financial decisions that are made by the CFO, the legal decisions made by the lawyers are all made by non-clinicians. So a lot of times that ability to advocate for the patients ends up being pushed to the side while they're concerned with more business or operational matters. So I'm excited to be one of those decision makers instead, and am infusing as much as possible from my experiences as a primary care doctor in the policy and processes that we're creating. Now, my path into this federal agency was different as well, too. My first job out of residency, I was a jail doctor. I absolutely loved it. I'm very interested in treating what we call vulnerable populations, so not just your run-of-the-mill private practice experience, but really treating those patients that are really at the edges of society, whether it be financially, educationally, or even through the criminal justice system. And that really spurred my interest even more regarding being an advocate. I didn't do any of their legal work, but I did definitely take every opportunity to educate them, to introduce them to what they can really get at positively out of the healthcare system. A lot of their only interaction was through emergency rooms. And to that respect, I really felt like I made a difference, more so than I would have just in a normal doctor's office, a normal exam room. With that, I then explored positions at community health centers. Now, community health centers are another opportunity to serve patients of vulnerable and disadvantaged backgrounds, where we're really treating those without insurance, or who are underinsured. So perhaps they have insurance, but their coverage is not strong enough, and they're really still, in at least community health centers, really still suffering from health disparities throughout their community. So I enjoyed working in that sort of format. I really got introduced to concepts of population health, care coordination, whole health, and really it prepared me for a lot of the decisions that I need to make as a policymaker now, and seeing patients throughout all of these experiences enriched my ability to make better decisions for them as an advocate and as a policymaker. So my path has been different. It's, I would say, what's needed. I would completely encourage as many of you as possible who are interested in looking at the larger issues that affect our healthcare system to really consider how a cross-sectional approach to healthcare could help more patients. You could be an advocate through many different means. It's not just law school, and it's not just medicine. Nursing, public health, these are all fields where we need leaders who are advocates. We need leaders who are decision makers and policy makers. By just looking at healthcare narrowly from a clinical frame of mind, you might really be limiting your opportunity to serve others. So I wish you the best of luck as you make decisions for your career, and really suggest that you look outside of the normal beaten path, the normal pre-health, pre-nursing, pre-med path, and consider crafting your own so that you can really be of service to as many patients as possible. Thanks so much, and good luck.